Hello. I'm very, lucky to be here, and I have some news for you. First is it's a very hard job, Charles, to have this speech after the fantastic lecture of Professor Kripan. And I have at the beginning two bad news. The first is my English is quite bumpy. And the second is I have no idea, absolutely no idea what I'm talking about. So,
it's always the same with the Germans.
Always the same. Okay. After we got these scientific insights, I first will introduce myself because nobody else will do.
I can introduce you if you want.
Okay. We are the first competence center in Germany of MBST. We are two directors, my partner, and we have 8 employed doctors. We are teaching practice of Marburg, Mainz, and Nuremberg, and we have specialized by support of 24 hours long distance races in all around the world. We were in Silverstone and all, I don't know, I don't want to count off. And it's a topic we've heard about in a very, very interesting way. It's osteoporosis between past and future, and as Professor Kripan introduced, we have to change the strategy. And it's a slide robbery. You saw it before, based on the work of Professor Kripan, and it has many reasons behind this very, very important sentences. I would show you some examples. Start with an 89-year-old female with a quite good T-score after minor trauma. She got a broken hip, but the neck of the hip, and got surgery. And in this surgery, after this surgery, she went to rehabilitation, and there happened a discharge because of pain and inability of move. They didn't check. They told her, come up and go, and the hip is operated. And she came to us, and we did a new diagnostic, and we saw horizontally and vertically unstable anterior and posterior pelvic ring fracture. And we sent these pictures to trauma center, which did the operation before, with a question what to do. They won't operate this old lady because the risk, and told us to immobilize this lady for between 6 weeks and 3 months. It's deadly. In any case, it's deadly. So we had a long talk to this lady and to the son what to do, and decided to do MBST with support of calcitonin, calcium, vitamin D, vitamin K, magnesium, and all this. And these are the pictures 4 weeks after MBST. And you see it's going to consolidate. We began to move her and to hire the last. And this next picture is 6 weeks after MBST. The movie doesn't work. No? Yeah. She's alone in her own home with some support of the son, and said, please show me the film, show me the film. And now she's 10 years later, nearly, no, not 10, maybe 8 years later, and she's still alive, and she repeated the treatment for the osteoporotic situation. And now it leads to the next slide. DXR as gold standard, I'm not sure. How we can find the right patients with DXR? Who believes? You're told we have to talk to them. We have to look for the risk factors. And we have to remember the DXR was never created for individual prognosis factor. It was for big studies comparing big population situations and never for the single look for any patient, never. And we know all of us know, it can lead to significant over or underestimation of the mineral content of the bones. We know it, but we do it, and we call it gold standard. And that's one of the reasons for this experience with good bone density and broken bones. You had a very, very nice scientific insight, but I believe we take the wrong instrument. We have to need better devices. And the DEXA, the only reason for the DEXA to get gold standard is we don't have alternatives. QCT is too expensive and lots of radiation, and the old ultrasound methods were not good working. So now my partner, he's my partner and he's my patient. And because his diabetes, I told him, go. And we didn't have our new device, and he didn't go to DEXA measurement. We did QCT, and this was a result, very, very bad. He's 67 years old, T-score minus 4.3, and Z-score 2.1. What did we do? Bisphosphonates, teriparatide, Prolia. What's the decision? Nothing. Exactly. Thank you very much. So we put him on the MBST OSP2, and we changed the diabetic medication, and he got exercises. And this is 10 months after we saw this. But this is measured by echolyte. So the problem now is, and the following problem is, we compare DEXA or QCT to echolyte. But in 3, 4, 5 months, we can compare echolyte results to echolyte results. And I'm very, very happy to have this device because we can measure the results of our MBST treatment. And that's a big step into the future, and that's the reason why I told in the beginning I don't know what I'm talking about. Yeah, but I have a feeling what I'm talking about, and we will get surprised and surprised every day, I believe, very fast, very, very hard. So, game changer, the combination of Ecolite and MBST, I believe, very strong, is a game changer. And as you told, we have to teach, we have to talk, we have to take it in the world, what we are learning, and we are learning in the moment. But I believe it's a game changer, and the Ecolite is a door opener for the MBST. We see it. And we tripled our osteoporosis treatment by OSP2 since the time I had a hard fight with Francesca, but now we have it. We tripled our treatments. And it looks like this. That's one of our young doctors, and that's the neck of the hip. And this is a guy with Morbus Wilson, Kappa, was heißt Speicher? Kupferspeicherkrankheit. Kappa, Morbus Wilson, you know?
Yeah, Kappa, sorry.
And he is 5 months after first MBST. He came with quite low bone mass, T-score, I believe, minus 2.7. And 5 months after MBST, he had a plus of 3.6%, and he had already quite good trabecular bone score 5 months after MBST. And we did a second session because he wanted, and measured by Ecolite, and we saw a T-score from minus 0.4, and at the neck minus 1.32, but with an excellent bone quality, and that's a plus of the Ecolite. We can have a impression of the bone quality, 19, and so he's in a very low risk factor. Yeah. And he wanted to get a next measurement. It's quite at the beginning of September, and he increased again. So he had 1.2, and now he is by minus 1. No, first he was 1.2, yes, and now he is by 0.2. And he's happy, and doctor is also happy. There's a next case. It's a lady with 2 major fractures of osteoporosis. She was in a very famous center in Frankfurt, and they did all is possible to do, paratite and Prolia, and all. And she had no increase of her measurements, and she had very hard side effects. So she came to us with a question, what can we do? The answer is quite easy, MBST. And we gave her hormone-related therapy, replacement therapy, and she came from 4 point anything to 2.5, measured by Ecolite. And you see here the quality is going quite well, yeah, and the fracture risk is going down. And I scanned her few days before I came here, and this is a result. Yeah, she's getting better and better and better after 3 times 5 hours MBST. She's a very hard-working woman, so she has no time for 10. And we did 5 in the March, and 5 in the September, and 5 in the March, and she will come in October, I think, again. I told her there's no need. Let's have a look in January to see what the curve is doing. But she wants to do again because she wants to go in next summer skydiving. I told her, yeah, let's see, can do it maybe. Okay, this is a very interesting case, and I would like to have a comment of you. This is a very young lady, very young, 40 years old, and she had a stand-up paddling in Mallorca, no, Fuerteventura, I don't know, Lanzarote, and just had a step in the sand, 50 centimeters, and this is the result. Young lady, and they did operation, and the time she came to us, it was a delayed union fracture over there, and she came to ask what to do, shockwave or anything else, or maybe MBST she had heard about, and came with this DEXA, T-score minus 2.2 and minus 1.8. So what to do without the right side? There's a fracture, minor trauma fracture, young lady, osteopenic to osteoporotic, what to do? And we did, first of all, control the DEXA. And we saw in Ecolight there is no, she's a good quality, and she's green. So no specific treatment is necessary. And we discussed what's the reason for this fracture, because we believe more the Ecolight than the DEXA. Greetings to Italy. What's the reason? And I asked her and asked her and asked her. She had lots of years depoclinovia. It's a estrogen. Estrogen. Yeah. And maybe that's the reason. I wrote I got in the information of the depoclinovia, and there is described it's possible to get local osteoporosis after this treatment, local osteoporosis. So I believe that's the reason. Now, she got 10 hours OSP2 with his for the foot, and to protect the bone. That's the reason. And at this place, at this time, the people say, an Ecolight, maybe it doesn't work, and maybe I say DEXA doesn't work, and I brought some papers. We have a growing literature demonstrating a strong strong working of efficiency of the Ecolight. So we trust. So there are just a few slides. And it's growing each month, I believe. Pardon?
We've just bought our Echo Light.
I didn't get it.
We've just bought our Echo Light scanner.
Die haben jetzt auch einen gekauft.
Ah, yeah, you bought one. Ah, so I thought it's a question. Okay, now this is another case. Sorry, my English is bumpy. I told you. It's a female. It's a medical doctor from Munich, and because osteoporosis, she became denosumab treatment. Last dose was in February 2019, and this was a result of measurement in the October, and they stopped the therapy because expected difficult sinuses surgery with expected protracted recovery times, though they in Munich stopped denosumab. They didn't give follow dose, and they gave no bisphosphonates and nothing else. So she became a very, very hard expanded rebound with, I believe, 13, 14 florid impression fractures of thoracic and lumbar spine. And she needed to come from Munich to Montabaur. 4 hours, 4.5 hours, one overnight stop, because she has a very painful situation. She was not able to work. She was not able to do their things of daily life, and she was broken. She was broken. She was like the boxman told in the morning. She was completely damaged. And after 10 hours MBST, she was without pain, and the fractures were consolidated. And now she is coming, I think in November she's coming. She's coming one time a year. And she's coming because we don't know what, we couldn't measure. Yeah? We couldn't measure yearly with DEXA. So I phoned her, and I gave her the information. There is one Ecolite in the south of Germany. It's in Freising. It's quite near to her. She will go there for measurement, and after we decide what to do. There's another case, very impressive. It's a female born 62 with breast cancer and treatment with aromatase inhibitors. And it started before, or in the beginning of this therapy. We did DEXA. She was 1.4, 1.9. And after beginning of aromatase inhibitors, we gave her at this time MBST, and she held her density, and she increased, and she increased. So what's a regular situation under this therapy? They go like this. Yeah, they crash down, and we hold. We hold and optimized. That's the normal way. This is the hip, and this is a spine, or maybe it's umgekehrt. This is a lady with low traumatic fracture of the wrist and metacarpal, and she came with a very painful osteochondrosis, with the questions, what about MBST? And my question, what's with the osteoporosis? And she said, no, I've no, because I did this DEXA, and it's minus 1.4 and minus 2.2. So we believe, we took the echolyte, and that's the truth. Yeah, she's in a very hard way osteoporotic with a very high fracture risk. So we gave her, it's not difficult to imagine, we gave her 10 hours osteo, and the follow-up is this. No, I saw her a few days before, and unfortunately we had a technical defect. She is not getting much better. So we are now nearly 4.5 months after MBST, and there is no very, very impressive movement. She's getting a bit better in the fragility score, a bit. But there's no, I had the hope I will show here a very nice follow-up, but I couldn't technical to print. So at this moment, I told we are walking into unknown territory. We don't know how long works MBST. We know it works, and we know it works at the bone, but we don't know when starting, at what time we get the spine better, at what time we get the hip better. We believe to know the spine is getting better before the hip, and we believe to know the fragility score is getting better before the density is getting better, but we have to measure. And if you bought one, I feel very good, and I feel we have to change our data. And you wrote me, we see crazy results, yeah, to compare to DEXA. It's in the beginning you think what did I wrong, man? And which machine is the right one? I believe very, very sure that the echolyte is the right one, and we know the DEXA is not the gold standard. You told we have to anyway have a look to a holistic proceed. The osteoporosis is very, very, if you go deeper and deeper and deeper, you have more Fragezeichen, Fragezeichen, Fragezeichen. Yeah? You have more questions as deeper you go, and it's an organic disease. We have to improve the bone quality. We have to improve the fall energy, and we have to have a look for the fall frequency. And this is it's going together with the sarcopenic situation. It's going together with a balance situation, and we have sometimes very high loaded patients with very high fracture risk. So to echolyte and to MBST, we use, of course, the physical activity. She's able to reduce the fracture risk similar to pharmacological treatment, about 30%. To trigger anabolic bone adaptation, we need more than 1,000 microstrain. So we need 1,000 microstrain is the movement by your own weight. This is 1,000 microstrain. But some of these people cannot move by their own. And if you don't have the energy, you need more repetitions. That's what you are doing in the sitting. And we had the crucial question how we do for these patients who cannot move and then cannot do this and cannot do that, because we have to have a look for the axial load, muscle tension load, load distribution, and for the systemic effects of the physiotherapy. And if there is a supraliminal stimulus, what kind ever, he has to be unknown surprising, or he has to be more load. And if you don't have more load, you have to frequent stimulus. And we use for this the stochastic resonance therapy. And I was surprising, you told we need vibration. And there are good studies for whole body vibration. But the whole body vibration is a good possibility to increase the bone mass, the bone density, and reduce the fracture risk. And if you take sinus impulses, the body knows, and the body says, oh. If you take stochastic impulses, like this, chaotic, you don't need the higher load, you can use higher frequent, and you have the surprise. Every time you have the surprise. And that's the reason we take this stochastic impulses with noise in the impulses, and that's a device. First, we took it at the race circuits for the drivers, for the pilots, to get better accommodation and to get better performance. And we had the idea, if it works at pilots, we try it at people. And it's three-dimensional, 2 plates. They move independent from each other with this stochastic vibration. And we believe by sure it's the best training, physical training you can do for all of them, and especially for the older and disability people. We have older people. They come to MBST like this. They have a benefit of the MBST therapy. They feel, as you told, they feel better. They feel. One lady told me, "Hey, doctor, it's like a bath in champagne." Huh? May I give you a kiss? Yeah, okay. And this effect leads to more presence, and leads to more brain activity, leads to more all this, and add on the stochastic resonance. I believe it's a game changer 2.5. Okay, now Next case. What's that? Unknown person. He will not have any benefit for. It's Ötzi from the Alps. So, thanks a lot for your attention, for your kindness, for your hospitality. Thank you. If there is interest, I have some more slides. Or shall we cut now? Maybe a quick one. Don't forget the gut if you treat the osteoporotic patients and if you treat the osteoarthritic patients. The gut is possible for one of the biggest inflammation systems we can have inside our body. So we look for the gut, and that's the same. So what I want to show, and after that we stop. This is one of our nurses. She had a DEXA, osteopenic to osteoporotic in 2021, and we did at 7:20, I don't know. At 7:20 we did 10 hours OSP. It was OSP 1. And 4 years later, she's quite good, but osteopenic. Now we repeat. So what I want to say is, we have the feeling, we have the imagine. It needs the time to grow, and after we have a steady state, and we have to measure now at what time we have the peak, how long we have a steady state, and at what time it will fall. And this is necessary to decide how to treat these people. We did before, if they had a severe osteoporosis, we told them 1 time a year. I understand you do it like that. Yeah. So, but we don't know if there's need to do that much. I had information of this 2 patients. She was quite osteopenic. It's DEXA halt. And we gave her the treatment in 23, I believe. 21, I don't know. I think I have. It's not right, but the message is she's getting better and she's holding her steady state. Okay, now it's enough. Thank you very much.
Hi, thanks for that. Just curious, when you said about the gut, what are you looking for with the gut, and what parameters are you looking for? What do you do for the gut if you feel that the gut is causing inflammation?
Yeah, we have. There is a laboratory with a special analysis, and dependence of this analysis, we try to give support, but. This is a very big and difficult field, and we have now one doctor came out of pregnancy, and she is going inside this, especially this theme. It's not my Especially if I have the feeling there is something wrong, I tell her, please look at that.
I agree. Another question. Thank you for that. Do you see that? Do you often see that the DEXA results and echo light results concur? They're the same.
Yeah,
Yeah.
yeah.
Okay.
The better the spine is,
Yeah.
the better is the conclusion of the both.
I'm with you. Yeah. Great.
And I asked every time I asked the persons, did you go to DEXA without clothes? More than 50% say no. I went there like this. In this case, you can put it out of the window.
Okay. Thank you, mate. Yes.
And the ecolight, you can do it every day if you like. If you want to say what we did yesterday, MBST, let's have a look how it looks today. Do it. Radiation free, it's comfortable. In the beginning, it's quite difficult. I thought you will learn never, but now I need 10 minutes. We did maybe 300 or something like this, and yeah, it's very helpful. Thank you. Let's do it.